everyone for coming on a snowy day. I really did think it was spring, and but as I was just saying to Kim, it's always worse in Montreal, so you can feel sorry for yourselves here, but at the same time we did get into the playoffs. And I was a little bit concerned, you know, when I was really excited to get this invitation, but a couple of weeks ago I was a bit concerned about coming because we had the Quebec elections, and I was thinking, oh no, I'm going to need a passport to get back into my province, but fortunately that settled down. So a huge welcome from the MQHRG in Montreal, our qualitative group. Many members of our group are followers of your network. They're on your listservs. They're coming to some of your talks, so a big welcome from there. Okay, so where are we going today? First, we need to make sure we're kind of all on the same page with a couple of concepts before we kind of get into the meat of the talk. So when I'm teaching courses, so I'm an anthropologist, but when I'm teaching courses in the health sciences on qualitative methodologies, you know, kind of the overview type courses, we always put ethnography up in the triumvirate with phenomenology and grounded theory as, you know, the three kind of big heavy hitters in qualitative research. And as an anthropologist, I actually had to learn how to do this because it's not something in social science that we're really taught how to do, how to articulate that thing that we do that's called ethnography here. And so I kind of had to learn how to make the familiar strange, as anthropologists do, in order to articulate this familiar thing that we actually do. And so circumscribing ethnography as a methodology, when I'm teaching those kind of courses, I use slides kind of like this, right? And you just kind of go through the characteristics of this thing that you say that you're doing. You know, the goal of ethnography is sociocultural understanding through this thing that we call thick description. You know, methods require participant observation, but there's often these kind of eclectic combinations of methods that kind of evolve as you go. But the thing I want to draw attention to here is this idea that ethnography is theoretically informed. Going into the field, it's sensitive to context when you're in the field, but then coming out, one of the important goals of ethnography is that you're going to generate insight that did not exist prior to going into the field at a theoretical level. Okay, so when you're teaching health science students this sort of interpretation of ethnography, it gets really complicated when you're trying to talk about analysis. What does this really mean, and what does this actually look like? Within the social science frame, the way we talk about ethnography shifts from those kind of overview courses. And ethnography then, it sounds like it's actually a caricature. What I just described actually sounds like, to the anthropologist, sounds kind of like a caricature. But we do the same thing with phenomenology, and I think we do the same thing with grounded theory when we're teaching these kind of courses. So for the anthropologist, ethnography is not a methodology. It's a way to engage with the world. And looking at it this way, the ethnographer's kind of research questions and emergent speculations are really kind of inspired by this iterative engagement with A, data, and B, theory. Okay, so as the ethnographer is kind of engaging with the world, they're doing this thing iteratively. So explicitly they're going in to the study premised upon some sort of social theory speculations, and then they're coming out with, you know, what we classically call in health science the so what, which is not just a so what for practice, but it's a so what for theory generation, and it's a so what for methodology generation as well. So the second thing we need to talk about before we get moving to is this idea of theory. What do we mean by theory? So we can talk about kinds of theories, so deductive theories versus inductive theories, and you've probably all heard and grappled with kind of this sort of distinction. So In inductive theory development, you're moving from the specific to the general, whereas in deductive, you're moving from the general to the specific, right? And in qualitative research inquiry, we generally talk about inductive, right? It's exploratory. It's from the ground up. It's speculations that are not hypotheses. Like you're not testing. You're inquiring with a speculation, which you will kind of test by moving forward and getting more data and thinking, does it hold, does it not hold? But you're not testing in the way that you would in deductive theory building. And so, but these kind of distinctions are actually pedagogical. It's important to draw distinctions, but really when you're in the field, even doing qualitative research, you're doing both all the time, as are traditional scientists. They're inspired by things that they see, and then they're building theories around it, and they're testing theories, and then they're inspired by what they see, and they move forward. So we're constantly doing these inductive, deductive things all the time, but we don't usually articulate it that way. Now the other thing we can talk about in kinds of theory is this distinction. Again, it's kind of a pedagogical distinction, and it's between explanation and prediction. So inductive theories in qualitative inquiry are often exploratory, moving up to the level of explanatory. So for example, the grounded theory might start out being exploratory to understand what's going on substantively in the population of interest, moving to a model that can help explain within a circumscribed way what the researcher thinks they're seeing. So there's an explanatory potential, but inductive qualitative theories generally are not predictive in the way that you would talk about a deductive theory being predictive, right? And generally the rule of thumb in theory development is the more explanatory your model is, the less predictive it can possibly be, and vice versa. The more predictive it is, the less explanatory it's going to be. And in qualitative, we try to move towards this kind of exploratory explanation or understanding and not prediction. So other things we can talk about in terms of theory, and this is kind of mapped onto disciplines, is the idea of theory. So something like a public health or nursing or psychology needing kind of theory to help mobilize practice change within the discipline, right? And you know, nursing, as one example, is really kind of founded on a lot of what are called middle range theories. Again, these are kind of deductive theories to really help move practice forward. So something like stress and coping, or attachment theories, right? They're middle range theories. They're systematic, causal explanations with tight models within them, built upon a lot of kind of deductive reasoning, and they help move this practice called nursing forward. Whereas in social sciences, like anthropology and sociology, for example, the practice mandate is not so strong, right? You're moving more towards these ideas of illumination, understanding, building knowledge for knowledge's sake, which then can be picked up and used in practice settings, but we don't have the same mandate. Although we're seeing that mandate kind of coming into what we do from funding bodies like CIHR that are now saying, well, you must have a knowledge translation component in your work. And we're like, oh, that's a cool idea. Okay, I'm going to move into practice, right? But that's not something that kind of internally came out of the discipline, although public health I'm sure probably kind of straddles, and there's probably disciplines that straddle that. But nursing for sure is much more kind of practice-oriented, and say anthropology traditionally was much bit more kind of focusing on illumination. The role of theory was illumination. So then we can also talk about theories existing at kind of these different levels, and we kind of do, you know, you have this paradigm, we talk about in qualitative research, and then under that you might have a grand theory, and then we could put middle range theory somewhere in the middle, obviously, and then grounded theory is supposedly somewhere down on the ground, and we have these small kind of practice-oriented theories. And why am I telling you all of this? The reason I'm telling you all of this is because, why? In order to think through my talk today and what I wanted to talk about, I thought, okay, what in the heck is this theory thing anyway? And where, oh where, do we put social theory? in these kind of schemas, you know, I think in a lot of health science disciplines are really kind of trained and conscious about teaching theory development. But social theory, which I started the talk saying grounds ethnography, is of a whole other order. And it's a different beast. And when you're talking to, say, novice graduate students who are coming to me from dentistry or medical education or nursing, and they're new to this thing that we're calling qualitative research, and I say theory, they don't hear theory through the same lens that I'm saying it, right? We're talking a different language. They're talking the language of epidemiology or biomedical science, and I'm talking the language of social science. And I swear to God, it took me the longest time to realize this, that what I was saying, they weren't hearing the same way, or what they were saying, I wasn't hearing the same way. So social theory is a different beast. And it's really used in an ethnographic project as an orienting frame, or like a sensitizing concept. So a theory like around gender would be a sensitizing concept that you could take into your study. And through your study, you could advance our understanding of gender, or power, or you could think of colonial theories or anti-colonial theories. They then also help you when you're in the field to do your analysis, because you carry them with you through the project. And in classic anthro speak, we talk about theory, social theory, being good to think with. So it's not explanatory, and it's not predictive. It's not really inductive, and it's not really deductive. It's this other thing. And if anyone has a better definition or interpretation of this, I'd be really happy, because I think I'm actually drowning here. And I don't even know it. So I would be really happy to talk about this afterwards, because I think it's something that we kind of do the osmosis thing with our students. We just kind of say it a lot, and we hope that it'll just kind of filter in, but we don't actually explain what this thing is. And for the life of me, I couldn't, you can tell, I can't explain what it is either. Okay, so that's as much as you're getting. We're going to move forward now and talk specifically about this idea of theory in, theory out in ethnography. So, as I've said, ethnography is premised on this commitment, right? Bringing social theory in. And as a methodology, it's concerned about meaning. So meaning as a theoretical construct that is produced through cultural beliefs and practices that are embedded in social realms. So a social realm could be a family. It could be a community. It could be the ER at your hospital. Okay, there's different kinds of social realms that ethnography would be concerned about. And then a critical ethnography would also be concerned to kind of uncover the repercussions of that meaning for social actors. So what is at stake for the social actors in that particular social realm? And I'm going to give you two examples. And these are examples of work that I'm very, very proud of. These are two of my doctoral students who have recently graduated, both in nursing. One, David Wright is at Ottawa, who was at Ottawa, and Lisa Chen was at McGill. And they both grappled with this thing called ethnography, you know, starting in those kind of overview classes with the caricature I showed at the beginning, and then moving into it as a much more heavily theoretical approach to engagement with the world, and have produced these really, really impressive works. So in the first example, David Wright was looking at the meaning of the good death. So the good death being a social construct and how it's produced through cultural practices, beliefs and practices within a social realm of the hospice. So for him, he was looking specifically at the hospice. And in his study, he saw how good dying was kind of accomplished by staff through different kinds of practices. So one practice was that the whole architecture of the building was anti-hospital. Like the hospice was very much committed to anything's hospital is bad, and so they were moving much more towards this kind of home type environment. There was this hypervigilance for symptom control and the comfort of the patient. A belief about the open awareness of dying. And this idea, this kind of imperative that families must be family, and families are not caregivers. So let the nurses do the caregiving, or the aides do the caregiving, the family, you just be family. And so it's these kind of practices that then, from the staff perspective, enabled good dying. But taking the critical look also at the data, one of the things David saw was how these practices exclude certain families who are not on board with this kind of normative idea of palliative care. And what it would mean to then be excluded within this kind of setting. Now similarly, Lisa's project, she started with social theory as well, and her project started with the Logic of Care by Anne-Marie Moles. And she took this logic of care into an acute care unit where people were both being cured, or there were patients being cured, but there were also patients who were dying. And she looked at the logic of care that was used to attend to or not attend to dying patients. And so what she found was that the logic of care was very much based around this kind of curative philosophy. And so those patients who were no longer curative were really excluded from a good standard of care. And felt ultimately that A, they didn't belong, and B, they didn't actually matter as they were dying on the ward. So these are just two really strong examples of what ethnography can do, and these were mobilized within nursing discipline, and so have theoretical as well as very practical so what conclusions in the dissertations. So I'm telling you all of that because those, I think, are really good examples, whereas what we're going to talk about now was a more challenged example of an ethnographic project that required a social frame, a social theory to kind of found it, and we couldn't find one. And so this is what I'm going to talk about now, is kind of what we ended up doing as a result of not being able to find a social theory to help us think about these issues. Okay, so this project began with kind of ethnographic pondering that was happening at the end of a prior project. And this pondering was about how families construct their lives after a child has died and they leave the pediatric institution. So they go into the institution with a child and they leave the institution without a child. And so that was the thinking that got me started on this project. And this thinking was kind of developed as I was sitting in kitchens or living rooms with bereaved parents, talking to them about their experiences since, well, first of all at the hospital, but then also about their lives after. And I was thinking, I'm not sure the clinical community understands what their lives are actually like months or years after this experience has happened. And I also don't think society really knows about this either, and it just really got me thinking. So of course when you have a question, what do? But you go to the literature, right? And so as a good researcher, I went to the literature to see, oh, well, I wonder what's out there on this topic. And what I found was there was a lot of literature But it's mostly, well, what I saw at the time was you could call it psychosocial literature, okay? So it's in the psychosocial domains. Most of the studies would start with kind of a statement like parental grief, or the grief after the loss of a child is the worst kind of grief. And they would qualify that or quantify that, why and how it is the worst kind of grief. And they would or a lot of the studies would also say, and there's nothing in the literature about this. And then they would go forward and kind of describe the 12 interviews that they did with bereaved parents, and how they had these suggestions for system changes, and that would be the project. And there's lots of great papers out there that do that, and they serve a very important purpose. I don't mean to denigrate that at all, but it wasn't helping me answer my question. And my question was really about what is their social world like after going through this experience. So I wasn't convinced that this psychosocial literature that I was finding was answering my question, so I really wanted to know, well, what else is out there? And so we then conducted a scoping review, just to kind of canvas. Scoping reviews are great to just canvas the literature and see what in the heck is out there, right? And so what we found in the scoping review is that even though all these research articles I was reading are saying, well, there's nothing in the literature, well, actually, we've found since 1990 400 completed studies on the experiences of families after child loss. And about 25% of these are in graduate projects that have never been published. So there are clinical psychologists, some social work programs, so master's and PhD clinical programs where that don't necessarily, they have a research component, but they don't necessarily have the same motivation to get it to print. And so a quarter of the 400 were actual projects that were still kind of in the form of dissertations or master's theses. And when we trace the authorship and the projects, they never actually made it into journals. So there's a lot of literature we saw. Like, that's 400 completed studies is a lot, right? But going through the 400 studies, again, we were very much in this kind of psychosocial domains trying to understand this concept. And so we as a team were forced to kind of ask, well, what is this object that the psychosocial researchers are kind of constructing through their research? And how is that different from the thing that we say we want to look at? And so this was something, again, true confessions. When I hear psychosocial, when I used to hear psychosocial, I heard social. That's not what psychosocial is. And it took me so long to figure this out. Why didn't someone tell me? So in the psychosocial, we kind of get like models like this, right? Like we have the individual surrounded by the family and the community and society. And then now we have the biopsychosocial spiritual, which adds this kind of, so there we have the individual, and then it adds these circles on top of the individual, and so this is supposed to somehow have explanatory power to help us understand what's going on in these people's lives. And so it was kind of through these kind of exercises that I realized, oh, I get it. Okay, so this is not what, as an anthropologist, I want to know about the world. This is really important for nursing disciplines, health science disciplines, but anthropology, kind of coming again through this social commitment and social theory, puts something very different at the middle. So at the middle, we don't have a patient. And at the middle, we don't have an illness. At the middle, we have a construct. And here, it was really us trying to figure out what is this construct that's at the middle? And how are these different social domains affecting this idea of child death? So these different domains, social institutions, popular culture, social actors, so the parents themselves, the research literature, public policy are all contributing at an ontological level, at an epistemological level, to this thing we're calling child death and to this thing we're calling parental bereavement. And it was there that we really wanted to go in our project. And so for the social scientists, this kind of model has more explanatory power than that previous one that I showed you, as an orienting frame to take into the literature and as something to think with about the data that you're getting. And it turned out that this little ball with the question marks, I just kind of originally put it there because what you don't know when you're going into the field, what are all of the things that you want to look at. And it turned out what we ended up putting in that circle was the internet. It became a whole incredibly important domain for the project. So, to recap a little bit. We found a theoretical hole in the literature. There was nothing that could take us directly at a kind of sociocultural level into our project. There was a hole we wanted to fill. And so in order to do that, now I'm going to kind of shift the metaphor to this idea of kind of the orienting frame or the scaffold. So theory as a scaffold that you can take with you to kind of overlay on the data, but also the data is going to help then. This is not like a highly engineered scaffold. This is a scaffold that's going to keep growing and changing. It's organic as you go into the field. So we went into the field with this kind of model in mind. And we used each kind of circle as a cultural location to get data. Now you have to also know that the anthropological ethnography understands data as being everywhere. So of course you have to go to the IRB if you have human subjects. But you don't go to the IRB if you're looking on the internet, if you're going into the research literature, if you're pouring through policy. It's a very different kind of data that you're working with. But it all kind of goes into the soup. You're not kind of, one kind of data is not trumping another kind of data. It's all in the project to help you understand and to better kind of construct what's at the middle in the diagram. So, I'm going to tell you just a little bit about the scaffold that we actually ended up building, and then we'll open for conversation. So, and again, I'm mixing metaphors left, right, and center. So, I'm giving our scaffold axes. Okay? So, the first axis in this scaffold was this idea of medicalization. And so looking through the research literature, so here, make sure we're clear, I'm not talking so much about the psychosocial literature, I'm talking about the sociological and anthropological literature on death and dying, on bereavement in general, and on parenthood, and on childhood. So there is no body of literature that is the anthropology or sociology of parental bereavement. That was the problem, right? That there was nothing. So we kind of snowballed around what we thought our construct was and tried to kind of draw in from related writing. And so in the literature on death and grief, you really see the shift from, what some scholars kind of characterize as this kind of the pre-modern romantic relationship with death, in which death was something that would happen to a community, to this very kind of hyper-individualized understanding of death, where death now happens to people. So it's kind of, death has been moved from a social realm into an individual body, and it's the individual body within a healthcare institution that now dies. And so this kind of medicalizing script of dying has also impacted how we understand grief. So likewise, grief and grieving would have been something that would happen that would have happened at a community level, and so the death would be kind of a social rupture, and there'd be ritual and practices that would help to kind of smooth down the rupture in the society. Whereas now, grief is much more medicalized. It happens to individuals. Individuals go to GPs or psychiatrists, and they get pharmaceuticals, and that's how we deal more with grief now. Now, one location we went to understand what was going on was policy, and specifically we looked at labor standards. And it was looking through labor standards, the codes and codes and codes and codes. We saw this idea of medicalization recur. And so that was kind of confirmatory for us. Okay, so the reason we went to labor standards was because in a pediatric population, parents who are experiencing the death of a child, a lot of them are going to have a hard time getting back to work, right? And this is coming from the psychosocial literature. We're like, oh, okay, from the psychosocial literature, this makes sense. So let's look at labor standards. So we looked at labor standards to see how the workplace is contending with, dealing with, helping these parents who have experienced this, the loss of a child. And what we saw in this kind of data was, first of all, child death is never, ever, ever separated out from other kinds of death. That labor standards really just kind of deal, there's like bereavement leave, and it's always 3 to 7 days, and sometimes it's paid and sometimes it's not, and it doesn't really matter if it's your grandmother or your child or your stepson or whoever, you always get the same amount of leave. But the only socially sanctioned way to increase your leave is to get sick leave. So across Canadian labor standards, and then we also looked internationally, we saw that the only way that you could actually get some accommodation for your experience is if you medicalize your sadness into a sickness, then get a doctor's note, and that will give you more time. So this is kind of just, I'm saying this, citing this as an example of how we kind of moved through that circle diagram to kind of confirm some of our speculations. So the next part of the scaffold that I'll talk about is this idea of transitions, and this is a bit complicated, so bear with me as I go through this, okay? So here we have different kinds of transitions. So the first kind is the demographic transition, and so this is drawing on sort of the historical record. And so it's because we have medical technologies like vaccination and social policies like democracy that we currently have a robust society in which children are healthy. But it's important to remember and reflect back how infant mortality itself didn't even show up on the public health agenda until 1900. Like prior to that, it was just assumed, it was kind of this natural fact that kids died. And families were necessarily bigger because a lot of the kids were going to die. And infant mortality ended up on the agenda not out of a moral commitment for children. It ended up on the public health agenda because nation states needed bodies for military reason, for protection reason, for economic reasons. So they needed the kids to stop dying. And that's a caricature of how things happen, but you get the point. And so as kids, as there were social policies that developed around keeping kids alive, we also saw discourses around children's rights, right? So the whole idea of the child's right, which didn't exist early 1900s, was developed. And so it's with these kind of transitions that we have the whole concept of a childhood. This romantic concept that we have today about children as being vulnerable and innocent and protected. That's a very, very modern idea. Kids used to be, they weren't in school, they were working on family farms or what have you. And so we see this demographic transition, and then there's this kind of accompanying value transition. So children lost their economic value because they were no longer working. They were protected. They were given these, these innocent, naive, protected childhoods. They were put in school, and they were no longer valued at the economic level, but they were gaining this social and emotional value. So kids now are incredibly expensive, but they're emotionally priceless. And so following this kind of argument, what we see happening is this moral transition as well. So children no longer die, and that then shifts to this idea that children are no longer supposed to die. So the next part of our scaffold has to do with these linear narratives that project children into adulthood. And so this is really drawing on a lot of the childhood literature. So here we see this tension between children as beings versus children as becoming. So we can think of a child as a being to which you bestow rights, responsibilities, subjectivity, agency, regardless of where they fit on this kind of developmental timeline, right? Or the other way, the more common way to think of a child, is that they're on the way to becoming an adult, and they need to be socialized in a very certain way to ensure that they become good adults. So they're being projected into future. And many of our cultural narratives pick this up. Children are the promise of future. You see these kind of metaphors, or the way children are used in advertisement. The whole idea that children are not supposed to die before their parents. This is kind of a normative statement about our social order. You pass your inheritance down to the kids. You live on through your kids. The kids are supposed to then outlive you and look after you in your retirement. And so one location where we can see this sort of component of the scaffold is in Hallmark. So in Hallmark, first of all, we went online to look at Hallmark cards dealing with parental bereavement. And when I first looked many years ago, there was nothing. It's now developed a bit, but I will tell you that there are the same number of cards for parental bereavement, and that is 3, as there are for pet loss. And these are the kinds of things that the cards will say. So parents never expect to outlive their children, and surely there is no loss that is sadder or harder to understand. So this is really kind of confirming for us this idea that I had just expressed, the children as becoming. So the next part of the scaffold is this idea of identity and personhood. And this is really nicely kind of conveyed through the work of Malacrida, who has done some work around miscarriage. And Malacrida writes about how both the deceased child and the parent's identity is constructed through various kinds of social acts. So she writes specifically about the non-gestures and acts of non-recognition that follow a miscarriage. And we also heard parents talk about, so the parents that we interviewed also talked about these sorts of things. So you can think of, after a miscarriage, the lack of cards that a parent would get. The grandparents don't come to visit. There's no big party. There's a styrofoam coffin instead of an oak coffin, which you would have had for, say, a larger child. And Malacrida is arguing that these non-gestures are really reinforcing the identity and the personhood of both the parent and the child. So if the miscarried fetus is not considered to have the status of a child, then the social responses to and around the non-child confer the status of non-parent to the parent. And so you can't be a bereaved parent if you're not even a parent. And similarly, for like the parents that we spoke to, and not specifically around miscarriage necessarily, they mentioned many, many kind of non-gestures and acts of non-recognition that they experience, like the neighbor crossing the street because they don't really want to talk to you, or the in-laws throwing out the kids' toys after the child has died, or people not recognizing the deceased child's birthday. And finally, we have this idea of social codes and exclusion that we saw throughout the data. So, talking to parents especially, they have a certain experience living in a society in which children are not supposed to die. They talked in terms of stigma, and so then this, of course, is an opportunity to go back to the stigma literature and think about how Goffman would theorize this. They talked about kind of evoking feelings of discomfort in the non-bereaved. And here we developed this idea of contagion, and this is an anthropological concept. How it's kind of there, but for the grace of God go I. The non-bereaved don't want to be around the bereaved for fear they're going to catch what they have, right? It's a sense of as if there is a social contagion that it could happen to you, and you don't want to be reminded of that, so you stay away. They also spoke about the policing of grief, and this is a concept that Tony Walter, who's a sociologist, has really developed. And this is kind of how, often well-meaning neighbors and family and colleagues will make little comments or statements about, isn't it time that you got back to work? Or, you've been crying for a long time now, and maybe it's time to stop crying. And there's kind of this implicit timeline imposed upon grief, and then it's almost as if you do go back to work, you're like, oh, you're better, and now we don't have to talk about it anymore, as if it signals this recovery, so everyone wants you to get back to work because then you'll feel much better, right? And parents really talk to us about really struggling to be not just a good parent, but a good bereaved parent, and trying to figure out what does that mean. So should I redecorate my child's bedroom, or should I leave my child's bedroom as it is? How do I remember my child? And we took this axis into, as I was saying, into the virtual world of the internet, and we've published some of that data in this paper. And we had a huge aha moment looking at what's going on online. And it was really instructive for us, because what we saw, and we have since talked to bereaved parents about this, it's not just an online phenomenon, but we didn't even know to look for it. And it was this idea of not just being a bereaved parent, but bereaved parenting. So even though the children are deceased, there's still parenting acts that go on. So especially in the online world, you can actually, okay, I shouldn't use that word, but you can email your deceased child, because there's whole kind of virtual neighborhoods that are set up through virtual memorials where you can have these kind of modalities which send messages wherever they send messages. And there's also these whole kind of communities of bereaved parents that form online in this virtual space, where there's a lot of positive things come from these kind of pulling together. There's a lot of kind of resisting of social exclusion that happens in our world. You can resist that social exclusion by being in a virtual world which is safe, where you can pick and choose who gets to come into your world and who stays outside of your world. But there's also kinds of bereaved parenting that happens that when we started thinking about the data, so interpretation of the bunny that jumps through the back garden as your son is an example of this kind of continued connection with. And the sense that this bunny is hopping through the garden because it's sending you a message from your son is sort of another example of how this thing, this concept or construct exists. So that's the scaffold. Future directions from this research, I have no idea where it's going to go. We're still writing and we're rewriting and we're thinking and we're rethinking about the model that I had put up at the beginning. And I want to open it now to you and hopefully have a great conversation about this. So, thank you.